Caring for the Vulnerable, Session 4A. We've been talking about vulnerability and vulnerable and the different populations and some physical factors that can cause someone to become vulnerable. However, today what we're going to discuss are the social factors that influence healthcare providers' care to the vulnerable and how the interrelationships or trends affect that care to the vulnerable populations. According to de Chauncey, there's 3 concepts that one must be able to master to be considered to care for the vulnerable population. One is to have a cultural competence. The second is to be resilient, and then to be an advocate for your patients. Let's look at cultural competence. Number 1. It's considered a practice paradigm that takes into account the principles of cultural differences. These factors influence principles such as marginalization. Was one marginalized when they were growing up? Were they discriminated against? Or ethnocentrism. Did they believe that their own culture was superior to everyone else's? In addition, using models to explore culture is correlation of cultural competence and one's quality of health. Cultural proficiency. You want to really become masters of skills and to have an open mind. How do you learn cultural competence? You always start with yourself through teachings and discussions and immersions into other cultures as well. You'll have an opportunity to do this when you do your service learning projects through your reflections. Next is advocacy and advanced practice. In the early years, it was very difficult for nurses. However, in 1976 and 86, advocacy to patient was required by the ANA Code of Ethics. However, before the 20th century, there were pitfalls that prevented advocacy in our practice, such as maternalism, autonomy and power, and of course the nursing shortage. In addition to that, the concept was difficult because it wasn't operationalized and therefore wasn't measured, so it had very little credence. In addition, there was influence of nurses versus medicine. Nursing history repeats over and over again how nurses were subservient to the physician, and the Gestalt theory for nursing advocacy was just beginning. So why is this relevant to nursing? According to Margaret Newman's theory, it expands our consciousness where we have open energy system. The process of interconnectedness is really important as it is the total body's mindset that will occur. The process of interdependence is important. The process of confronting vulnerability as well is important. And you need to be able to interconnect these physical, whether it's biological, psychological, or sociological, in order to have this interdependence. Is it relevant to nursing? You betcha. Interacting with others on their turf is a complex process, but one that's very rewarding, and it will open up your mind to a new world.